The views and opinions expressed on any program are those of the producers and/or the persons appearing on the program and do not necessarily reflect the views and opinions of FRC Media, Bristol Community College, or the City of Fall River.
Hi, welcome to another show of Linda and Laura. And today we are very happy to have with us our guest, Michael O'Brien. Mr. O'Brien is a member of the DAV, and he also does work with the Brockton VA Hospital. He's here today to talk to us about what benefits are available to veterans. Many veterans are available for benefits, but they're afraid to go in and apply, or they just don't think that they're able to apply. Can you tell us a little bit about yourself first, Mr. O'Brien?
I served in the United States Air Force. After getting out of the Air Force, I spent 2 years in the Army National Guard, and then another 2 years in the Coast Guard Reserve. After leaving the Coast Guard Reserve, I was a correction officer at Walpole State Prison. And then after that, a police officer in New Bedford, Massachusetts.
And you live now in?
Now I live in Fall River. I'm assigned to the DAV at Brockton VA Medical Center.
So you came to the best area.
Save the best for last.
There you go. Nice to have you here.
Thank you.
What would someone do if they were a veteran and suffered some sort of disability? What steps would they have to take to get disability?
Well, the main thing is all they would have to do is contact us, the DAV, or they could contact their veteran service officer in their city or town, and we'd get the ball rolling. All they need is their 214, the discharge papers, and we would assist them in filling out all the paperwork and coach them on what they need to do to file for their claims if they have any disabilities. If they don't, then we'll counsel them on what's available to them.
Do you think that some of the veterans are hesitant to come in and see you? Do you find that?
The younger ones, yes. You know, the military has a mindset, you don't go to sick bay, you know, a tough guy routine type thing. And a lot of the veterans don't go to sick bay or anything, and that carries on for a little later until they start getting sick and they realize that we're out there for them and we're there to help them, not to hurt them.
Yeah, so how do you think, how does the DAV break down those barriers or get the message out there to the veterans?
Well, we reach out to them the best we can. We host different things, like we'll go to events at schools or something like that, or we'll post things on the air or invite them in.
Do you, what are some of the different disabilities that the DAV sees that because there are a number of things. I mean, if you watch TV, we're seeing stuff, the Camp Lejeune, the water on Camp Lejeune, Agent Orange. What are some of the different things that people come in for?
Agent Orange is for the older veterans that were over in Vietnam, Thailand, Korea. They just expanded it to some other areas. And they added a couple of presumptives, like they added heart condition and blood cancer. The younger veterans, it's toxic exposure to the burn pits, and that's mostly what we're seeing. And the younger ones, a lot of mental health, PTSD, depression, a lot of that we're seeing. The Camp Lejeune, we're not seeing too much of that. The Camp Lejeune is a cancerous type thing.
I think that the Camp Lejeune, the advertisements, et cetera, that are on TV, I had a gentleman that called, you know, that he was in Camp Lejeune at that time, but that the attorney wanted to meet with him because the attorney takes a portion of whatever that settlement is or that money is.
That's correct.
Where if they went to you, you don't get a portion of that. It would go totally to that veteran. But then I also heard, and I'm not sure if it's true or not, but I also heard that if you get that settlement, let's say you were on disability and you get that settlement, it's deducted from what you're going to receive. Is that true?
Okay. If they go to an attorney, that's a tort act. That is not involved with the DAV or the Veterans Administration or anybody else.
So it's an action of tort?
It's a tort act. That's with the, a civilian attorney against the federal government. If they come to the DAV, now that's a claim for a veterans agency for a disability claim. That has nothing to do with the attorneys, and they do not take anything out of that. The only thing, we don't get involved with the attorneys at all. The only thing we will tell the veteran is watch out for a scam. There are a lot of scams out there.
Isn't that a shame?
Non-attorneys calling them. But as far as the attorneys, we do not get involved in that. That's a separate issue between the veteran and the attorney.
Interesting. Now, let's say that somebody has a hearing loss, and they attribute that to so much gunfire that they, were present for, what have you. What do they have to do to come in? If they have a certain percentage, do they get more? What is the percentage guideline?
What happens if they come in for hearing loss claim, we file the paperwork, and then the VA sends them to a doctor. It's called a competent exam. And what they do is they give them a hearing test, a hearing exam, and then they do a background check on where they were stationed, what their job is, what their exposure was, and that's how they determine what their claim is. Their claim is based, a rating officer makes a claim based on the severity of their hearing loss. It could be mild, it could be medium, and it could be severe. So that's how hearing loss is.
So if you were in the service many years ago and you never claimed a disability, and now you're hearing from friends, oh no, you can, that's actually a claim that you can put in. Do they feel like, well, I've been out of the service for 15 years, I can't go in now? Like, is there a time limit?
No, there is no time limit. You can file a claim anytime. The problem is, the longer you file the claim, the harder it is to prove. Unless it's a presumptive claim, it's up to you to prove that it's service connected. So if you got hearing loss now, you have to show that that hearing loss is connected to the military. So you have to get a letter from a doctor or something showing that that is more likely than not connected to the military. Now, a presumptive claim would be something where the Veterans Administration automatically presumes that it's connected to your military service. You just have to show that you have a diagnosis and that you was at that particular location at the time, like Vietnam, Thailand, or some of them other places. Just show that you're there during a particular period of time and that you have a diagnosis for a certain injury, or not injury, but disease, and it's presumed that it's service connected by the military. If it's not a presumptive, then it's up to you to prove it's connected to the military.
So going on what Linda was talking about, the percentages are, so if there's a veteran that's disabled 50% or 70%, are they able to work? At what point?
Yeah, they're able to work.
And at 100%, are they able to work? Or I think maybe that there's fear in that.
It depends. If you're 100%, just 100% without unemployability, you're able to work. If you're 100% unemployability, you're restricted on the work that you can do. For instance, if your disabilities are for a back problem, and you're over there working, picking up construction equipment, working in construction equipment where you got to pick up heavy things, then now you'd be violating what you're out for. So no, you couldn't work at that, but doesn't mean you can't work behind a desk or something, or answering phones or something like that.
And how about, so for the veterans that do have injuries, are they able to go back to school? So if they get disabled, they were a police officer or whatever, and they are disabled, unable to work, does the DAV help them, or the military help them?
Their benefits are not limited to disabilities. They have education benefits, they have a multitude of benefits. Yes, they can go back to school, and we will help them put in the paperwork for school, sure.
Now, if you're a disabled veteran and maybe the disability check isn't enough to assist you, are you also eligible for Chapter 115?
Sure.
You are,
yes.
So you can get
We
both.
don't deal with 115, though. The Veterans Service Officers from your city or town deal with that. We deal with the federal government and the Veterans Administration. Your state benefits are handled by the city or town Veteran Service Officers.
Just for people that are watching this program, could you explain a little bit about what 115 is?
115 is your state benefits. If you're low income or something like that, again, that's all handled by the state. We don't deal with that. So I'm not particularly versed on everything with that. I do know that it has to do with your financial needs.
So if anybody has financial needs
Correct.
and they're eligible for Chapter 115, that would be the individual that would go to our VSO, Michelle Hamilton,
Correct.
apply through that office?
Correct.
And you're with the DAV, the Disabled
Right.
American Vets, you do specifically disability claims and
Correct.
that type of thing?
Correct. Now, the state VSO also assists them with registry of motor vehicles, their benefits with tax deductions and stuff like that.
What is it with Registry of Motor Vehicles?
They have access to plates, like for instance, if you have a Silver Star or a Gold Star or a
Purple Heart?
Purple Heart, you don't pay for your plates, you get free plates. And there's different type of tax deductions, property taxes and stuff like that if you're 100% disabled. Again, that's all handled by the state VSO.
Now, to qualify for any of those deductions, you must be 100% license plate. You have to be 100%, or any
No,
veteran gets.
Well, 100%, or you have to have the Silver Star, the Bronze Star, the Medal of Honor, the Purple Heart. That applies for it. But yeah, 100% would also apply for it.
Oh, that's interesting, because I thought that if you were a veteran of war, a veteran of war, that you were eligible at the RMV, that one car that you register, that you wouldn't pay the registration fee.
No, that's not true. I have
Okay.
veterans plates and I pay my fee.
That would be
And I'm
that's a great
veteran.
idea.
Yeah.
But that's too bad though.
Yeah.
But
But again, that's handled by the veteran service officer. That's not handled by us.
so where is the DAV located in Fall River?
In Fall River, they're at 755 Pine Street, which is right across the street from Ruggles Park.
And what hours do people, can they just walk in and come and see you guys?
Right now, there is no service officer at all over there, but yeah, they could come there. We had a service officer there 2 days a week, Tuesdays and Thursdays from 9 a.m. to 1 p.m.
So right now, anyone who wants to apply for disability would call the Veteran Service Officer in Fall River, and you're located in her office, and
That's
you're taking claims
correct.
there.
Right now, I'm assisting the veteran service officer because there's no other service officer around this area, and she contacted the Brockton VA hospital and requested assistance, and I came down to assist her.
Because I think the good thing about going to City Hall, sometimes on Pine Street, the parking is difficult. And at City Hall, any veteran can park, especially with the plates.
Right.
Or if they have a handicap placard, but with a plate, you can park at any meter, anywhere, and it's free of charge. You don't pay.
Okay.
I like that the Veteran Service Officer, Michelle, paired up with you guys and that you're working out of the City Hall, because I think that there are other benefits that, if you find that they could be eligible for other benefits, you're right there in that office that they could talk to someone. So I think that's a fantastic idea.
Well, I think it's good because you're right. If you're filing a claim for disability, but you find out in doing that that person is struggling, they can also file for Chapter 115.
Correct.
And also, they know that they get a tax exemption if they're 100%, so they can go right to the tax office and fill out the forms for that. And schooling as well.
Right. And the older veterans, what a lot of the older veterans don't realize is they're eligible for VA benefits, and they're also eligible for Social Security benefits, which you can collect at the same time with no penalty to each one of them.
Wow.
So you can collect VA disability and Social Security disability at the same time.
I'm glad you brought that up, because I'm
Now,
sure a lot of people don't know.
if you apply for just Social Security insurance, that takes to effect because of the income type implications. But Social Security disability, there are no limits on that.
Well, that's interesting to know, because I know that with Social Security, some people who worked, in private sector and put into Social Security, and then they got a job, federal, state, county. When you retire, you don't get your full Social Security check.
Yeah, that's the WEAP program.
Yeah, they take
Windfall
that
elimination
away.
program.
The Social Security level drops depending on what you get for a
Correct.
pension, which they've been trying to fight that forever. I think that was done I don't know if it was President Reagan, was it?
I
I don't
recall.
remember who it was, but
Yes.
they changed that law then, which was kind of unfair. But then when you talk to people, my sister-in-law used to work for Social Security, and she said, but really you don't put all that money in. So,
It's interesting.
yeah,
It's
Well, if you're working 2 jobs, you put the money in.
exactly.
You know.
so that. How often do you get claims for the area Fall River veterans? Do you find that it's slowing down, amping
No,
up?
it's consistent. I get calls at home sometimes because I give out my cell phone, so I'll get calls late at night sometimes if I can help them or whatever. And if I can't meet them up there at Brockton VA Hospital, I make an arrangement to come down here and meet them. And now it's even easier because I can meet them right at the City Hall.
Well, that is just that's absolutely thrilling to know that you guys are right there in the City Hall and able to work like that. So, can we go back to, you talked about the burn pit. Now, I just learned about the burn pit, several years ago from some of the veterans I was working with. Talk about what that is. Do you mind, and how that affects the soldiers, and then how it turns into a disability?
Pits today are not like the burn pits like back in Vietnam or Thailand or anything, which they were small. They burnt like the human waste and stuff. That's what they burnt over there. The burn pits over in the Middle East are huge. They're the size of 3 football fields.
Wow.
And they push everything in there. They push medical waste, human waste, motor vehicles, computers, everything goes in there. They douse it with kerosene and they light it on fire, and it's huge. And these poor guys are, I mean, I don't care where you are on the base, they're subjected to that. So, I mean.
And the disabilities you're seeing, that lung disease, different types of.
Yeah, right now there's not a lot of physical stuff. It's mostly the mental stuff right there, but there is some physical stuff coming out of there, yes.
Where would you send individuals that you talk about, that the younger vets suffer a lot of PTSD and that type of thing? Laura is a certified clinician and therapist. Do you refer them out?
Brockton VA Hospital.
Brockton VA?
Brockton VA Hospital has an excellent, they have a facility just for mental health, and they have an excellent facility there. They have all kind of peer contacts there, inpatient, outpatient, a massive program there for.
I can't imagine how anyone in the military that saw horrific things could ever take that out of their mind, that, it's got to be there. It's got to be there. It's on how you're able to block it out, and, I'm sure you don't forget.
I'll tell you, as far as the mental health, what at least in Brockton VA, what we're seeing a big uptake in, all of a sudden there's a lot of people coming forward, is military sexual trauma with the females.
Really?
A lot of it. There is a lot more than what people realize. Of course, it's confidential, and you want to get their privacy, but there is a lot of it, and the public doesn't realize how much of it there is.
That's interesting, because I did talk to Michelle Hamilton about that. My line of work was always investigating sexual abuse cases. And they're trying to do more with women veterans as well, because I don't feel that women veterans tend to engage in veterans events. Even at the Vets Kitchen, most of it is men.
Well,
there are a few women there.
In 2-day period up in Brockton, just 2 days, I took 5 claims from women.
Wow.
In 2 days. And that's not just from Brockton, that's the surrounding area, and they go there because of the privacy that's there.
Do you think that, why do you think that they're ramping up and you're seeing more of that? Do you think it's more acceptable to go and seek treatment for it?
Well, the VA has been more acceptable to it, and they're starting to open up more and go out and seek for the people to come forward.
Well, I think it's very difficult for a person who's been sexually abused to talk about it, because lots of times they blame themselves, which is not the case. But working in the line of work that I did with that, I would have people that came forward 20 years after being abused, that, it got to the point that they felt comfortable talking. We always hid that stuff. You know, even a lot of the clergy sexual abuse, people didn't talk about it. Nobody was going to believe you. The
That's-
fear
yeah,
of not
that's-
being believed
That's
is the big thing.
Now the thing, the other thing I'd like to add is when the DAV, like I'm at the bottom of the level, I take your complaints, I put them on paper, and I send them in. What I'd like to say is, even with these females that have come forward, I send everything to our main office in Boston. I have nothing but nice things to say about them. They will stand by you 100%, follow you all the way through. That's another reason why I think more people are coming forward, because they see that the DAV is there and they'll follow them all the way through and they coach them all the way to the end. And if they're denied a claim, they fight for them and they appeal for them and they stand there with them from beginning to end. And Boston is one of the top niche offices in the country.
That's so good to know.
Yes.
Yeah.
They have a best reputation, and most of the guys that get positive results in their claims come out of the Boston office.
Wow.
That's good to know.
When was the DAV established, and how was it established?
Oh God, that was way back in 1920 something, I believe it is. Actually, the Fall River chapter just got their 100th anniversary.
Wow.
Right.
I was up there in the convention. I accepted the plaque from the National DAV for 100-year anniversary, which was last
And that
year.
was, yeah, that was last year. I think it was the year before because they had COVID and couldn't do anything.
Yeah.
So they're like out 102 years of being an organization in Fall River.
But Fall River and New Bedford are the two oldest around
No
Wow.
kidding.
Yes.
In the country.
in the country.
Well, that's amazing. I think a lot of people don't know that. So
Correct.
that
Both Fall River and New Bedford became 100 years the same year.
no kidding.
But the other thing is, too, that if you look at the various, like World War II, for example, more people from this area fought in World War II as a community than several other communities. I learned that when we were putting up the Vietnam Wall.
Yeah.
Somebody mentioned that, and I didn't, you know, I really wasn't aware of that. People did enlist. They signed up. They went. They wanted, you know, to maintain the freedom of our country. So we have. That's why we treat our veterans here so well, and why we have more than other communities have.
and there's
We've had some good service officers out of the Fall River office also in the past.
Oh God, I
They
remember.
just, two of them just retired. They're excellent.
I remember having, you know, the VSOs in Fall River. I remember as far back as Mr. Coyne, Jimmy Coyne's dad. He was a VSO. We always had really good VSOs in Fall River that really took care of our veterans. And we have phenomenal veterans organizations.
Sure.
Next week we're going to have Dawn Trahan from the Vets Kitchen come in and talk about what she does there. And it's amazing to
And
see.
she has
all-
good food. I've been there.
She has
do
good
have
food.
good food.
She does. And I mean, she's got chefs that volunteer there, and everything is a volunteer basis, which is great. But I think the work you do is remarkable, and
Thank
I'm
you.
really happy to hear that Boston does such a good job at carrying somebody all the way through, because if not for that, you know, people still feel kind of isolated.
And Boston office is the main hub for all of New England. They're the hub for Vermont, Maine, New Hampshire, Rhode Island, Connecticut, all
Wow.
answer to Boston.
Wow.
So that's good to know.
Yes.
I'm sure that some of the stories that you hear from veterans
Oh, yeah.
must be bothersome.
Yeah.
How do you deal with that?
My
Because it
ex-
must resurface your own.
I've just in my career, I've heard a lot of stuff, so I mean, I'm built up for that, and I put up kind of a wall myself. I mean, between my different jobs, I've heard everything.
And you're on, and you know, you said like, you know, you're on the bottom of it and you're filling out the application. But to me, you're the most important piece of it, because you are where that veteran is coming first, and you're, you know, the people in your line of work are going to make it or break it for them. So I feel that your job is the most important, because you're comforting that veteran, you're making them feel that this is an okay process, and you walk them through it. So I have so much respect for the people in your position, not to, you know, say the people in Boston, you know, or not, but, you know, the frontline people are the most important people, and I think that that gets overlooked a lot of the time.
But I mean, even after the claim, they'll come in and ask us what their status is, and I can pick up the phone, call Boston, and the guys call right back, and they'll answer me, and we have a good relationship as far as information back and forth. So
And really, Laura's right. you're the first person that they see. And, you know, they're going to trust that you're there to help them. And the way, if you said to them, well, I don't really think that that would work, it's going to be upsetting to them. So it is people that do your job. It is a very important job. And for people to call you after and still ask you questions means they really feel comfortable with you.
And it's not just me. Other members of the DAV, people approach them, and they, oh, all these guys are great. They'll send them my way or send them to the other service officers. So it's not just me. All the guys in DAV should be respected.
Yeah.
Now, is there a way, I mean, if you're doing this in City Hall, I can tell people, if you call City Hall, the number is 508-324-2000, and ask to be connected to the Veterans Office. That's the easiest way for people to get in contact with you.
That's correct.
Okay. And then, you know, meetings can be set up at a time that's good for both of you to be able to meet. I think you do a wonderful job.
Yeah.
And I thank you for your service
Yes,
and
thank you.
for your continued service to do
Thank you.
all that you
both.
do.
Thank you.
Yeah.
It was certainly a pleasure having you on, and maybe we'll have you back again. Oh, and before I forget, I did want to say we have the Joe Marshall Vet Center here that helps veterans with going back to school and getting different trades and things. So this, again, in Fall River, BCC, they're there as well because they can take that opportunity to
Fall
do
River's a
something.
great city.
We agree.
We agree. Thank you so very much
Thank you.
for
Thank
coming
you.
on today.
Thank you.
Well, that concludes another one of our shows, and we thank you all for listening. And if you do have any questions about veterans benefits, Laura and I are blessed to be the veterans liaison to the council. You can contact us, and we will help you, or contact 508-324-2000 and ask for the VSO office, for the Veteran Service Office with our veteran agent, Michelle Hamilton, and she will connect you to any services that you are in need of. Thank you so much.
Thank you.